Nous sommes ici à Calgary comme infirmières, comme infirmiers syndiqués pour prendre la parole. Nous allons parler de la violence en milieu de travail, nous allons parler d'une stratégie de ressources humaines, nous allons parler d'un système de produits pharmaceutiques pour pouvoir faire des changements ensemble pour le bien-être de tous nos membres et le bien-être de tous les Canadiens et Canadiennes. You know, the fact that nurses got active in the last election, it showed us that we could make a difference. It showed us without being partisan, we could put our healthcare system as number one and we can change things around. And it created for us a momentum where we started the Speak Up app, where every nurse in the country, through their mobile device, can connect with every politician from the federal to the provincial level on our issues, on key issues involving nurses.
85% of our members in a survey told us that they know that patient safety is being put at risk due to short staffing.
I work in community health and I see every day where patient safety is compromised with the increasing caseloads and referrals for service with no increase in resources.
It's just so empowering to see that there's a collective group of nurses across the country that are so willing to speak up against budget cuts in healthcare.
Nurses need to speak up collectively as a group to support the public in getting better access to programs and resources in our communities for our mental health patients.
I know in my workplace we've increased the amount of screens we're doing. We're doing more mental health screens on everybody that comes in, and I think just continuing with those things, that will help.
We know healthcare best, and we need to find our voice to speak up about the issues that we know.
Union activism is so extremely important. We are being whittled away.
It was so important for me to download the Speak Up app. I was able to send quick emails to my MLAs, MPs with issues that I found important to me that I couldn't quite put actual words to yet, and this could be a great framework to be able to do that.
In Nova Scotia, the government pays to the Workers' Compensation Board $60 million a year to compensate nurses and other healthcare workers that are injured on the job.
So I tell nurses at our site every day to speak up, to stand up, to be activists in our own workplace, because no change is going to happen unless you identify it.
We see every day people who have to make those choices between their meals or their rent or taking their medications.
Having a national pharmacare program would stop people from having readmissions into the hospitals. They would be healthier out in the community. We would stop seeing so many exacerbations of chronic conditions.
They see it, they feel it, they know when their staffing numbers are inadequate, it impacts on the care that they can provide patients.
The majority of registered nurses wear their black and whites, so patients are really starting to realize who the registered nurse is. And before they thought there were so many nurses working, and now that they see that there's only one nurse today or one tonight, they're really starting to realize that there's not as many nurses that they thought.
What concerns me the most is the staffing, because I find a lot of times we are working short and nurses are not replaced.
We're very concerned with what's happened to Canadian Blood Services. They have taken RNs out of the screening booth and replaced them with workers with no healthcare background.
We have to get over this myth that it's not okay to speak up, or we're afraid of a manager or an HR department, because we're not.
Jordan's principle arose out of an issue that occurred in a Winnipeg hospital in the early 2000s, where young Jordan Anderson, who had a chronic illness, was in the hospital, and the family wanted him to go home to his own community. And he actually died in the hospital, in the Winnipeg Children's Hospital, because the federal government and the provincial government couldn't agree on who would pay for his home care services.
Jordan's principle has helped Indigenous children get access to health care immediately when they need it for emergency use. So there's no squabbling or arguing about who needs to pay for what.
We're being kicked, we're being thrown to the floor, we're having racist comments made to us, and this is not part of our jobs.
There's so many challenges for people just to find care, find someone to look after them, and it's boiling over.
We're too busy worrying about our safety. How are we any good to our patient population?
Nurses and allied health professionals experience more violence, more unpredictable workloads and volume than ever before.
We have to be able to recognize symptoms of PTSD, and the employers have to be putting things in place to help.
There is no shame in courageously serving my patients or residents and accepting fully and talking about the impact that it has on me.
A young Aboriginal woman who had no family, and she was pregnant and she was going to give birth, and it was way, way, way too soon. And that baby was coming no matter what we did. And there was no time to get her anywhere but a bed behind a curtain. And that baby was born, you know, sort of into a basin. And together she and I watched that baby take its last breath because there was nothing that we could do. And those are the pieces that haunt you.
Patient care is ultimately our goal. Those goals are not achievable without real cooperation and commitment by both our federal and provincial governments.
Having a new health accord in Canada is very important for me as a nurse, and for my patients, and for all patients, and for all citizens of Canada.
We as nurses don't take care of ourselves well enough. We're always putting others ahead of ourselves and looking after the needs of everybody else on the list.
We're prone to take care of everybody else and we forget ourselves. It's important to take time for us.
The problem with the NCLEX is that it's invalid to reflect the values that Canadian nursing has to serve its unique and diverse population.
One of the other major issues with the NCLEX is the poor translation issues. We found that our Francophone students have been struggling quite a bit, so that's been one of our major advocating points.
We know what patients need. We just have to get to the table, and if there isn't a chair at that table, we bring one. And if there is not room at that table, we create our own table.
Nurses need to speak up. Nurses need to say, enough is enough.
Together, when we speak, we are making a difference.
Violence is not part of our jobs. We need to collectively speak up.
This is our time to speak to politicians, to speak to administrators, and to our peers.
Speaking up is not just about our workplaces. It's about our families, our communities, our future, our country.
Let's talk about what we're dealing with so we can be better in the workforce, better nurses for our patients, and better for our families when we go home.
We can't do it alone, and we need your voice to help us make change.
Across Canada, nurses need to speak up collectively.
Nurses speak up, and we can get everybody on side.
We must speak up.
You're a proud nurse, I'm a proud nurse. Together we will speak up.